Welcome to our presentation and review of the 2013 National Patient Safety Goals. The National Patient Safety Goals were developed by the Joint Commission, an organization that accredits and certifies healthcare organizations and programs in the United States. The goals are updated every year and help organizations evaluate the safety and quality of healthcare provided to patients. The goals can be found in their entirety at www.jointcommission.org. The purpose of these slides is to help you understand the National Patient Safety Goals from a broad, cross-settings approach. Emphasis is placed on your role as a member of the healthcare team in promoting patient safety. We are not associated with the Joint Commission in any way. The first goal that we're going to discuss is identifying patients correctly. Use at least two ways to identify patients when providing care, treatment, or services. For example, use the patient's name and date of birth. Make sure that the correct patient gets the correct blood when they get a blood transfusion. Improving staff communication. Get important test results to the right staff person on time. Read back orders and document that it was read back. Report important test and diagnostic procedure results on a timely basis to the correct person. Document time, date, and names of individuals notified about critical values. Using medications safely. Before a procedure, label medicines that are not labeled, such as medicines in syringes, cups, and basins. Do this for medicines on and off sterile fields in perioperative and other procedural settings. Reduce the likelihood of patient harm associated with the use of anticoagulation therapy or blood thinners. This requirement applies to organizations that provide anticoagulant therapy or those providing anticoagulation prophylaxis on a long-term basis. Maintain and communicate accurate patient medication information. This is called medication reconciliation. Find out, record, and pass along correct information about patient medicines. Compare those medicines to new medicines given to a patient and make sure that the patient knows which medicines to take when they get home. Inform patients that it's important to bring up-to-date medication lists every time they visit a doctor or go to the hospital or other healthcare institution. Some individuals may need to bring all their medication bottles to appointments to make sure an accurate list is compiled. The next goal is preventing infection. Reduce the risk of healthcare-associated infections by adhering to infection control policies. This helps to save lives. Use the CDC and the World Health Organization hand hygiene guidelines. Use proven practices to prevent healthcare-associated infections that are difficult to treat, such as those caused by multi-drug resistant organisms like MRSA, CDI, VRE, and multi-drug resistant gram-negative bacteria. Use proven guidelines to prevent bloodstream infections from central line contamination. This requirement covers short and long-term central venous catheters and peripherally inserted central catheters or PICC lines. Implement proven guidelines for preventing surgical site infections and urinary tract infections associated with indwelling catheters. The next goal is identifying patient safety risks. Healthcare organizations should identify safety risks inherent in its patient population. Identify patients at risk for suicide. This applies to facilities dealing with psychiatric patients or patients being treated for emotional or behavioral disorders in general hospitals. In the home care setting, find out if there are any risks for patients who are getting oxygen therapy, such as fires. The next goal is preventing mistakes in surgery. Make sure that the correct surgery is done on the correct patient and the correct place on the patient's body. Mark the correct place on the patient's body where the surgery is to be done. Pause before surgery. This is called timeout to make sure that a mistake is not being made. Reducing the risk of patient falls. Assess patients for the risk of falling and reassess. Make sure everyone on the team is aware of fall risks for identified patients. Use bed alarms as needed and find out if patients are taking any medicines that can make them sleepy or dizzy. Preventing bed sores. Prevent bed sores in nursing home patients and those in long-term care. Find out which patients are most likely to have bed sores and take action to prevent them. Recheck patients for bed sores. This concludes our presentation and review of the 2013 National Patient Safety Goals. We hope that you have enjoyed watching and have found the presentation helpful.